This month's Peak Performer is locally sponsored by UR Medicine Orthopaedics and Physical Performance.
It's my first love. The demands are really specific to the movement practice that you're doing. The movement that I do is largely repetitive, full range of motion, typically fast. I had a child almost 6 years ago. That was really when I started to notice this really excruciating hip pain. I met Dr. Giordano and saw his team, and they did some tests.
Ellie had symptomatic labral tearing in the setting of high-level physical demands in sports. She partnered with our physical therapy team. After realizing that her condition was just not going to improve to a degree that she was happy with, we ultimately decided that surgery was the best option for her. Surgery is one small component of making a dance athlete well. Partnering with a physical therapy group that really wants to be customizable and individualized and provide a very personalized one-on-one style of care. And really try to get her back to the high level of dance, both teaching and personal performance that she was hoping for.
I get excited to think about the creative potential of a new project, to see students who maybe danced in their previous years have come to college to dance, and that passion gets reignited in them. And I also love that it brings people joy.
For more peak performance stories from UR Medicine Orthopedics and Physical Performance, visit 13wham.com.